Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Nadira Modinela Karinagus and my student number is 29 and I'm from class B. Today, I would like to tell you about podcast that I have took and the title Is Coffee Bad for You? People who drink more than 4 cups of coffee a day could be shortening their lives. A study of more than 40,000 people suggests that at the level of coffee can increase the risk of dying by more than 50%. How does coffee rise a likelihood that I understand to be already 100% by a further 50%? Does this mean that chances of dying go from 100% to 150%? I think we should behold now what the research, which was carried out on people in the United States, actually said. Was this man and woman aged under 55 who drank 28 cups of coffee a week had a greater than 50% increased mortality risk. Now, what the means is explained by Dr. Vivek Elf, a healthcare at the MIST Intelligence Unit and Chief Executive of the Healthcare Evidence Consultancy Basin. What they mean is not that you have 150% chance of dying. Is that any given moment in time, people who drink walnut cups per week, they had a 50% greater chance of dying than those who didn't drink. So, in other words, any of the time you want, and that does sound quite alarming. It does sound quite as long, but these are relative figure. So if your risk of dying at any given moment is very low, then elevating it to 1.5 times. That is still a low number. So should we reduce the amount of coffee we're drinking if we're drinking more than 4 cups a day? Well, I think that makes the headlines is this big figure. What is less the put around the news is all the caveats behind the study, which to be fairly others, they were very expensive about in the actual research. When you look at it, there could be lots of other factors other than the coffee that could be contributing to this effect. People who drink coffee more maybe smoke more or drink more alcohol, and that might be heavy contributory effect. What they have done is trying to statistically strip that out using certain methods, but even though you can try to strip it out, statistically, these factors can still have an effect at the other things that's really important about this. It's a single study, even if there's a medical study that's perfectly conducted, you can have random variation in the results. The one group of people for whom coffee forms a particular questions mark for their health is pregnant women. But when Emily Oster, an associate professor of economics at the University of Chicago, became pregnant, she found the advice on coffee to be frustratingly conflicting, but she figured she had the statistical training to get to the fact of the matter. She's written up her findings in a book explaining better. When I first found I was pregnant, I really wanted to have a cup of coffee. It was like first thing in the morning, and then it's like I talk all of a sudden, said Emily. I think that's all for me. Wassalamualaikum warahmatullahi wabarakatuh.